Baby Carolina is just minutes old. Her dad, utterly enraptured, too emotional, he says, to speak on camera. With her full head of hair and expressive smirk, Carolina is the latest addition to the Hereford, Texas community, one of about 30 babies delivered at the regional medical center every month. But lately, this rural hospital has been forced to close its labor and delivery unit on an almost weekly basis. There just aren't enough nurses to keep it open.
You know, we've got a state-of-the-art unit. We've got great doctors, but again, nurses are the life and soul of the hospital, and we've been short part of the week and have had to go on, what we call diversion.
Diversion, says hospital CEO Jeff Barnhart, means a woman in labor will be transferred to the nearest hospital, 50 miles away in Amarillo. If there's not enough time, mom and baby head to the ER, where there's no guarantee that a specially trained labor and delivery nurse is on duty.
The most important thing about their training is that they can identify when something's going wrong, if it looks like the mother might need a C-section, or if the baby is in a position where the cord is being compressed.
Chief Nurse Candace Smith worries that the nursing shortage, coupled with a recent surge in patient numbers, could impact overall care at the hospital. For every nurse pulled into the labor room, there's one less on the floor for other patients.
Everyone does their very best to make sure that the quality does not slip, but there are days that it does.
How does that make you feel?
Sad.
What's happening here at Hereford Regional isn't an isolated problem. In a recent survey by the health advisory firm, the Chartis Group, 99% of the rural hospitals surveyed said they were experiencing staffing shortages, with nurses being the hardest vacancy to fill.
Pandemic burnout, low pay, and early retirement are just some of the factors feeding into the nursing shortage in America's rural hospitals. Experts say most facilities are now operating at minimum staffing levels, while some are suspending services altogether. Some fear things could get even worse now that a new federal vaccine mandate for healthcare workers has taken effect.
We've got less than 50% of our nursing staff in rural America vaccinated. And I don't think anybody I talk to in the space, whether they are hospital executives or policymakers, expects it going to be anything other than harmful.
Hereford Regional CEO Jeff Barnhart shares the concern, even though 86% of his staff is already vaccinated or has filed for an exemption. The focus now, he says, is on getting the outliers jabbed and on recruiting more nurses incentivized with higher pay. Still, he expects the labor and delivery unit closures to continue. The one thing he doesn't want, though, is to shut it down completely.
The thing about it is we're in a community that we've got a lot of young families here. We've got to continue to offer this service here.
A service vital to this community's future, one baby at a time. Toni Waterman, CGTN, Hereford, Texas.